Hello. So let me explain what is IUI or intrauterine insemination and how does it improve the success of you conceiving as compared to if you would have tried naturally, how does it work better? So intrauterine insemination is a procedure in which a washed or a processed semen is then selected and then put into the uterus directly. Okay? Here what we are actually trying to do is to stimulate the ovaries and trying to create a good quality egg. For that we are going to give you some medicines, sometimes in the form of tablets, sometimes in the form of injections or a combination of both. And then we call you for the follicular monitoring, wherein we actually see on sonography if the follicle, that is a fluid filled balloon in which the egg is situated, so is this follicle growing nicely? So that is checked on serial sonography, which generally will start in the first initial days of your cycle. So as this egg starts growing and we monitor the follicle starts growing, we will conclude that the follicle is mature sized when the size of the follicle reaches around somewhere between 17 to 22 millimeters. At this stage, the egg inside this follicle is more likely to be mature, and that's why then we give you the injection called as HCG. Now this HCG injection helps in the final maturation of the egg. Also, it helps us to actually know the time of your egg release. So when the egg gets released from the follicle, will be controlled with this HCG injection. So we know that the egg is going to get released somewhere around 36 hours from this HCG injection. So we would generally call you 40 hours from the time of HCG. So suppose, let's say if you took the injection in the evening, late evening around 10 o'clock, then I expect that you're going to release the egg from the follicle after around 40 hours. So next day, that means we'll have to skip one day, and then next day we'll call you around in the afternoon time for the procedure of IUI. When you actually come here, the husband will be required to give us the semen with the help of masturbation. Now we will be processing his semen with special media. These media are actually sperm tonics. So the fertilization capacity of the sperm will be improved by this media. This process is called as capacitation. That means the sperms become more potent, more motile, and they're able to fertilize the egg better. So this processing takes around an hour. Once the processing is done, again we'll do a sonography. We'll confirm that the follicle is burst out. That means we don't see the follicle on sonography. Sometimes we see free fluid, sometimes we see the follicle crumpling. Okay, sometimes there are many variations. It's not necessary that we have to see the follicle completely collapsed. And then we deposit the processed sperms. This will select the best sperms, and then we deposit them with the help of a fine catheter into the uterus. So what we have done, we have first crossed the barrier of the cervix or the mouth of the uterus, which many a times does not allow the sperms to go upward. So first we cross the barrier. Second thing that we do is we achieve the right time. So the egg and the sperm will be closer to each other at the right time. Third thing that we have done is we have brought them closer. So in this way, IUI always improves your success as compared to you trying naturally. It's very simple, it's effective, and does not have any side effects. Many patients ask me, can I conceive twins with IUI? Now whether you will conceive twins or not will depend on whether you have one follicle growing or two follicles growing or more than two follicles growing on sonography. So if we give you some injections or tablets to grow more than 2 or 3 follicles, then you're more likely to have twins. Otherwise, there are less chances that you'll have twins with IUI treatment. So my best wishes to you.